When we come back, we're going to find out about good hearing for children and how it's so important. We'll find out what the common middle ear infection is all about.
Welcome back to the program. Now, if your child has difficulty sleeping and is unusually irritable or constantly seem to be tugging or pulling at one or both ears, you may want to take him or her to see the doctor.
And this is because the child may have otitis media or an inflammation of the middle ear. It is a common problem, with 75% of all children estimated to experience at least one episode of this condition by their 3rd birthday.
And to tell us more, we spoke to Dr. Eng So Ping, an ear, nose and throat surgeon in private practice, and Raki Shori, whose 4-year-old son had to undergo emergency surgery as a result of a severe case of middle ear infection. And we started by asking the doctor if this condition is easily diagnosed.
Unfortunately, it is something that is not so easily diagnosed because you need to have a sharp clinical acumen to be able to pick up the diagnosis. And you need to have some experience in being able to do a good clinical examination and establish the diagnosis.
And what would that be? I mean, what are
the symptoms would be very suggestive. In otitis media, the more typical sort of otitis media that would present would involve a dramatic picture of having severe pain, fever, and severe some hearing loss. And this sort of presentation would cause you to kind of be suspicious that the person has otitis media.
Yeah. Well, Raki, I know your son, 4-year-old, he had otitis media. I mean, how did you suspect that he had this condition? How did you find out?
Okay, in the beginning, I just thought that it was a normal ear infection which was clogged with wax. And I brought him to NUH, and they also thought, like how Dr. Eng said, you know, you need expertise to deal with this matter. And yes, NUH did help me a lot by providing me the wax solution to remove the wax. For the first few days, that really helped, and his pain subsided. But subsequently, after about a week or two,
it didn't go away.
Yeah, it didn't go away. It came back.
Right.
It kept on coming back, and when it kept on coming back, I got a bit worried, and I brought him to my GP. So the GP recommended me and said that it doesn't look very good and he doesn't have the special equipments to deal with the matter, and recommended me to go and see Dr. Eng.
And that's when you finally knew what was wrong with his ear. But what made you suspect, what made you want to bring him to the doctor? Was he touching his ear? Was he rubbing his ear?
He was having fever, and of course I could see there was a little bit of discharge, but the discharge at that time looked similar to a wax. It didn't seem to have any kind of pus or blood at that point of time. But when his fever kept on coming back and he kept on complaining of ear pain until it reached the peak where he started crying. That the pain was unbearable. And that's when I brought him to the GP, and the very next morning the GP recommended me to go and see Dr. Eng.
Dr. Eng, right.
So, Dr. Eng, yeah.
Dr. Eng, maybe you can explain to us, middle ear infection. Middle ear, I mean, where exactly is it? Because I am not really quite sure, and we've got a model in for us.
Yeah. So this is a model of a human ear, and if you look at it, the human ear is anatomically divided into 3 sections. The first section is the external ear, which is from the earlobe to the ear canal, and the inner ear is referring to this organ here, which comprises the hearing organ as well as the balance organ with the nerves, and is housed within the skull. And the middle ear space is really the space between the outer ear and the inner ear. And if you look at this model, it is a space that is filled with air, and it has a tube called the eustachian tube that connects all the way to the back of the nose. And for this reason, you can imagine why that if the child has a flu or a bad sinus infection, the infection can track all the way up to the middle ear space and cause inflammation and infection.
But how do you get this infection in the first place?
Quite often it is a result of a bad flu. Sinus. It usually comes from the throat and the nose infection, and it begins to ascend upwards towards the middle ear.
Does it mean that when parents suspect, or when kids, the children have flu, it should be treated immediately? We tend to kind of let it go away. We'll just let them fight it off by themselves. We shouldn't do that.
Well, a lot of times the flu or the infection of the throat or nose does not result in this. And so there's really not so much need to be overly anxious about the extension of the infection going to the ear. But having said that, there should be some prudence and to be a bit careful on the behalf of the doctors to be sure that the infection is not spreading to the ear, and that is decided upon by a good clinical examination.
Well, Rocky, how is your son doing now? I mean, you've gone on treatment. Is it something that has gone away, or does it keep coming back if you don't manage it properly?
Okay, at the moment, of course, with all the surgery has been done and the follow-ups, all the follow-ups with medication, and Dr. Ng, practically every week I have to bring him back for suctioning just to maintain, because it's supposed to be a bacterial growth, Dr. Ng?
Yes.
Yeah, and so that's why it doesn't go away very easily.
So you have to do it every week.
Yes,
is that absolutely necessary?
Yeah, until he becomes a bit better, because I think Shivin's case was quite severe.
Right.
Yeah, his case was quite severe, so that's why we had to do it every week. And now, thank goodness, he's much better, and so we do it maybe every fortnight.
How long does it take for one to, totally cure this condition?
Well, it again varies from children to children.
Right.
But on average, if after the surgery, the infection should clear within a month, a couple of weeks to a month. The reason why we needed to do the treatment for Shivin is because his condition is really quite serious, and it continued to discharge past through his ears despite me putting in a tube for him to ventilate the ears.
Is surgery the first choice or the last resort?
Quite often the first line of management is, of course, a course of antibiotics, failing which then there could be a need for surgery, because if the pus cannot be relieved, it may begin to get complications, and for that we actually have to do this.
But you mentioned that kids as young as 6 weeks can get this condition.
Actually,
what would be the option then?
Yeah, more of a typical age group we see is between 6 months to 1.5 years. That's the prime age group that they
And if it's severe, they still go under surgery?
They do go under surgery.
What about adults then? We're talking about children, but can adults also get this condition, middle ear infection?
Yes, they do. Although in adults the presentation is quite often less dramatic. That's because we have a better immune system and a more developed eustachian tube system. So the common presentation for an adult would be more of hearing loss, and you get a good clinical examination which show that there's fluid build up behind the eardrum.
Rocky, in the meantime, I mean, while he's getting treatment, he's getting better, but has there been any other perhaps effects of this condition besides the inconvenience? Is he hearing well? Is he able to?
I was just speaking to Dr. Ng during the past visit, and he did complain that his left ear, he had a little bit of difficulty hearing. And I brought him back to Dr. Ng, and Dr. Ng said that we are still monitoring him. That is why I'm bringing him back quite often. And we'll monitor the situation, because maybe it's because of whatever residues are in the ear still present. So hopefully when it clears up, I hope that he'll definitely get better and he will not have any kind of hearing problem.
And that's Dr. Ng and Rocky Shourie, whose son had the infection. It's amazing how most children, or a large portion of children, actually get that condition, but we are unaware.
I think the main thing with children is sometimes as parents, you can tell when something's wrong. So once you're unsure what's wrong with them, it's always better to be safe than sorry. Just go for a check, and they'll let you know, do a few tests. That way you know for sure that things are okay.